Hey, thanks for coming out, everybody. Today we have a pretty interesting topic. We have Dr. Robert Johnson or Bobby Johnson. He's an oral surgeon, just like me. But unlike me, he did something else. And I don't know, did you do this in residency where you developed your own toothpaste? Or
Yeah,
go
it
ahead.
actually was. We actually have a lot in common because we're both oral surgeons in the Seattle area and both went
True,
to Tufts
true.
for dental school, which is pretty
That's
cool.
right. Yeah, yeah. Undergrad. Yeah, Tufts Dental School.
Yeah,
Got to represent a little bit.
that's right. Go Jumbos. That's
Yeah,
the
yeah.
name of our Wi-Fi and everything. We let Jumbos permeate our life.
I have the license plate frames is pretty much all I got. But
Do
yeah,
you? All right, that's something.
something.
Um, but yeah, so we developed Duo Toothpaste. We being my wife is also a dentist. We met in dental school. And
Yeah.
she's a GP. She practices over across the lake in Kirkland. And we started it with two friends as well. And it was during the really the med school portion of my training, so certainly a little more free time than when you're in the trenches as a intern or a resident.
Yeah.
But we were on vacation and we just kind of, one of those days we just had a great day. It was like 2 in the morning and it was time to wind things down. And one of our friends was just like so dismayed that we had to end such a fun day and night by something as boring as brushing your teeth, which kind of got the gears turning. And we're like, yeah, it is crazy how like we're essentially using the same products our grandparents did. I mean, if you walk down any pharmacy aisle or your grocery store aisle, like by far the most boring portion of the grocery store is the toothpaste aisle. It's just plastic tubes from the same three companies that really haven't changed that much since the 50s. And so that got the gears turning on Duo, which is a whole thing entirely. So, and then I guess I should also
I
say,
got this.
Stevie,
I
yeah,
tried it. I
there it
tried it
is.
this week. It's interesting. I like it.
Cool.
It's a little pill. It's literally a pill.
It's a little tablet.
Yeah.
So it really like it blossomed from there. And Stevie, again, my wife just jumped right in because she's like, as a GP, part of your day, every day, is convincing your patients to brush their teeth and do all these things. And like, instead of being this obligatory chore that you have to do, we're like, it should be exciting, and like, why are you brushing with the same toothpaste in the morning as you are at night? Like, most people, myself, I guess, look forward to our coffee in the morning and then, at night, whether, it's a little dessert or a nightcap or, whatever, it's like, there's these bookends to your day that should be special. Duo was born, at least the concept was born. Then we
Right.
kind of went, really drilled in for several months of researching toothpaste and what ingredients are actually necessary, what's there just kind of as a legacy ingredient, if you will, to make this gelatinous paste. So as you showed, Duo is a tablet toothpaste, which is really cool for a lot of reasons. One of which is it comes in a recyclable glass jar with aluminum cap there. The plastic tube is a pretty antiquated thing. Now thankfully people are trying to get rid of
You could
single-use
travel with this
plastic.
better too. Like you can just throw this in my little bag and not have to worry about it squishing around.
Not
Which is
squishing
nice.
around. It also doesn't like TSA liquid requirements. You don't have
Yeah.
to worry about that like you do toothpaste.
Right.
And it's not sensitive to atmospheric pressure change. It's never going to blow up in your DOP kit or whatever.
Yeah. And you feel like you get all the pills out. Like in the toothpaste tube, it's like, you try and get that last bit out. It's a pain in the butt. I actually do like the pill. You can just throw it in there and chomp on it and then, crush it up and then brush. But yeah, before we get it more into the toothpaste, I just wanted to get, and some of I'm really curious, we'll get into this a little bit too, I hope. Fluoride versus like fluoride alternatives and what you guys chose for Duo and why. But first of all, are you from Seattle? Like you ended up in Seattle, but are you guys from there?
I am from here. I grew up in Issaquah.
Oh, okay. I grew up in Bellevue.
Oh, did you? Okay. Oh, I grew up pretty close to each other then.
Yeah.
But yeah, I went to Issaquah High School.
Yeah.
I come from kind of a family dentist. My dad is a dentist in downtown Seattle, and my grandpa's an oral surgeon here in Seattle.
Nice.
And I went to UW for undergrad, then jumped over to the other coast to Boston, which
Yep.
was a fantastic
Oh,
experience.
I loved it too. It's great.
Yeah, really great. I mean, incredible city, incredible school. Met my wife. Stevie is from Philadelphia, Center
Okay.
City, Philly. So she's an East Coaster.
Yeah. My med
And
school was Drexel, where I
okay,
went to
all
medical
right.
school. Yeah.
Wow. So you know Philly too.
Yeah. I've been performing full arch dental implant surgery since 2012. I started back then with Nobel implants and I continue to use them today. getting consistent results over time and seeing these restorations in function over that length of time has basically strengthened my use of the product. There's over 100 implant systems out there. I just choose the one that's been the most consistent for me. But that's awesome. So you went to a 6-year program, you matched, and then you ended up staying in Seattle and working, right?
Yep. Yep.
Yeah. And then during medical school, you guys were like, and now we're going to get into the fluoride. The fluoride's a freaking hot topic, right? It's super, like with everything. I mean, I'm not going to get into all the politics and everything, but I mean, it's big. It's a big deal. And for you guys to kind of come out with this, in the same time frame as, the stuff that's happening recently is interesting too. So why not fluoride, or why, you guys use hydroxyapatite, correct?
Correct.
So tell me the difference. Like, what's the difference?
Yeah, so, we kind of stumbled into this too. Certainly when we came up with the idea of Duo, every intention of based on our dental school education to use fluoride. But then when we really dove into the research, nano-hydroxyapatite kept coming up. So what it is, and in dental school, there's a lot of education about nano-hydroxyapatite with bone grafting and implants and stuff. But
yeah, I've used it in bone grafts. I use it in residency. I remember we use it for various things, calvarial grafts, just fill the defect, like whatever, for other things.
Yeah, so this is like a well-established thing. But what happened, and this is just an interesting backstory, so in the 60s, NASA needed to figure out that astronauts were losing both bone and tooth density in zero-gravity environments. And so NASA actually originally, in 1970, patented nano-hydroxyapatite. And for remineralization purposes, which is strengthening enamel, kind of being a proxy of minerals, they made it 80 to 100 nanometers. So it actually gets into the dental tubules to help increase contact time and plug the tubules. And then that patent was sold to a Japanese company in 1970. And then extensive research was done, including with the University of Tokyo for that decade, on the effectiveness. And that research is ongoing now in all parts. At this point, it's been several decades. Huge body of literature showing that nano-hydroxyapatite is just as effective as fluoride at remineralizing teeth, which is the main purpose of fluoride too, to make teeth stronger.
Right.
But it's also got all these other benefits too. So
it's not toxic.
Yeah, and that's,
a bunch of it.
It's we know it's not toxic. So, the reason we've decided to do it is it was just as effective as fluoride without any of the question marks, right? And these question marks have been evolving over the decades or whatever, but they're there, certainly. And then there's the political component that obviously convolutes the whole thing too. So it not only does it remineralize teeth, but also whitens teeth, which fluoride doesn't do because it develops a new glossy layer of enamel. It's a white mineral, so it reflects light better, so it makes brighter teeth. I didn't even believe this at first, but I kept reading about it, and it's true. It is just as effective as chlorhexidine, which is a basically antibiotic mouth rinse. I know you know, but for the listener's sake, at preventing plaque accumulation.
That's cool. Chlorhexidine,
really
like, cool. So like if you're in the operating room and they give you a choice of like surgical scrub brushes and things, they have chlorhexidine ones to like scrub your hands with before you do a surgery. Like iodine, there's chlorhexidine, there's other stuff. So it's definitely potent that way. Antibacterial, that sort of stuff.
It's potent, and chlorhexidine, ubiquitously kills all the bacteria in your mouth.
Yeah.
Another conversation that's ongoing and getting more attention is just the health of the microbiome in general, but the oral microbiome. And so if you use chlorhexidine or an alcohol-based mouthwash, you're just killing everything, even the good bacteria.
Yeah, we tell people generally for chlorhexidine, you really don't want to use it more than a week. There's other side effects, like it stains your teeth, it stains your tongue brown. That's annoying.
Yeah, and it could, leave opportunity for pathogenic bacteria to outcompete the good bacteria.
Yeah, you're going to grow other stuff sometimes, yeah.
Yeah. So that's really cool. And the mechanism is pretty cool too. It essentially acts as a decoy. So the plaque accumulates on the nano-hydroxyapatite that's not on the tooth instead of the tooth surface.
Right.
And then the other thing that's really cool is because it plugs dental tubules, it treats dental sensitivity. Because there are other toothpaste that use potassium salts, like potassium nitrate, famously like Sensodyne.
Sensodyne, yeah.
Which is helpful for sensitive teeth, but that just stops the action potential, the nerve signal from going from the tooth to the brain.
Yeah.
So yeah, it helps numbing and it helps with sensitivity, but it doesn't actually treat the sensitivity. Where nano-hydroxyapatite remineralizes the dentin in the dentinal tubules, which fluoride doesn't even do,
Yeah.
stops the fluid pressure from pushing on the nerve, and results in less sensitive teeth. So
That's
I
a
like it.
huge one. So sensitive teeth, like there's obviously Sensodyne, there's other ones that market directly for patients, oh, with sensitive teeth. I feel like if you guys did that too, like, it just automatically does it, really. Like that's huge. The other thing is, and I see a lot of patients, and you probably do in your practice too, is like there's teens that come in with oral ulcers, things like that, that may or may not be sensitive to SLS. And you
Yes.
guys, right, it's SLS free, correct? And can you
Yeah,
explain what that, like, what SLS is? If people don't know.
absolutely. So it's SLS-free, which is sodium lauryl sulfate, which is a surfactant. So surfactants are essentially soap molecules that make things foam. And foaming's good for a lot of reasons, like in detergents, when you clean your floors or whatever, because it helps get in the nooks and crannies and carry the therapeutic benefit, if you will, around. So SLS is used in a lot of things, but it has been shown to be an irritant. So like the sores you're talking about in your teenage patients, like canker sores, red gum, just general irritants because it's mixing things up. It's also a little hostile to the oral microbiome again. And surfactants in general, soap is amphiphilic, right? So soap is, not to get too in the weeds, but has a
No, get in the
hydrophilic
weeds. It's
component.
fine.
All right, here we go. So soap has a hydrophilic component, which is just a chemical property that means it loves water, it
Yeah.
attracts water.
Right.
And then it's got a hydrophobic component, which means it repels water. And that combination kind of makes a layer that makes a bubble, right? And that's good in soap because the component that repels water also attracts oil. So like we've co-evolved with soap for tens of thousands of years where you wash your hands with soap and that soap latches onto the oils on your hand, and then when you rinse your hand in water, then the water loving part pulls all of the bad stuff out of your hands and gets rid of it. So that's good for hand washing and a lot of things, but in the mouth where saliva is as beneficial a thing as we can do, keeping a
Yeah. There's
hydrated mouth,
IgA. There's lots of things in saliva that are helpful.
lots of things. And so what something like a surfactant does, it actually pulls the water out of the mouth and contributes to dry mouth. So that's why we were pretty stoked when we figured out a way to make Duo foam up without a surfactant, and especially without SLS, which not only dries out the mouth, but also is an irritant.
It definitely does foam up. And so like I use it again this morning. I went to Starbucks earlier. I got like a wrap, and then I went home and brushed my teeth before I started the podcast with you. I was like, I'm just going to brush right before and see what happens again. And then you chew on it for a while, like not even a while, less than a minute. And it starts you can start to feel it like get more like, like you're normal, like foamy. Like then you take your toothbrush in and start brushing everything. And it's a lot. It's not just a crushed tablet kind of powdery thing. It turns into like a foam paste thing that you can brush with.
Yeah. Yeah, there were other tablet toothpaste before us, but we were the first ones, dentists created or whatever that, and their whole thing was just making it sustainable, the recyclable component. But
Right.
the ingredients weren't that great. So, like you
Right.
alluded to, there are a lot of tablets out there that you bite into it and it's chalky or it's
Hmm.
just like a blast of
So it's
mint
like a
or
Tums.
yeah,
It's like
exactly. Like
that's what I was
make
thinking. It would be like a Tums or something. You're like
yeah, which
those are
is
a
something
little
we definitely
tough
have to explain.
yeah, a little tough to hang in your mouth for a long time. But no, it's pleasant. I use this. I use the normal one. You have two different ones. This one with the purple dot is for nighttime use, I assume, because it has melatonin.
Yeah, we actually
Interesting.
have four.
Four?
So to kind of run it back to like making
Yeah.
toothpaste more interesting. So we have the original, which
Okay.
is just the best tablet toothpaste for oral health that we could create. So we're very proud of that. It's just the base for all of our tablets. And then we have one that is Energy, which has 10 milligrams of caffeine.
Nice.
So yeah, so all of these supplements absorb through your mouth as you brush.
Yeah.
You still brush and spit it out, but just like sublingual medication or the mouth is highly vascular and you absorb a lot of medications through it. So yeah, so caffeine, just 10 milligrams
So
of
10
caffeine.
milligrams. So I think when you buy like a caffeine pill at a pharmacy or something off over the counter, they're like 100 milligram tablets normally, right? And I forget what a cup of coffee might have in it. It's less than 100, I think.
I think typical cup of coffee is like 80 milligrams,
Yeah.
but like a Starbucks, it's 140 milligrams for so a lot more caffeine. but that coffee has to go through your gastrointestinal tract and then
Right.
be
Well,
absorbed.
it's mixed with sugars. It's mixed with a lot of other things that, mess things up. Yeah. 10 milligrams is like a little, like, you don't want to be all jittery for your first wisdom tooth case in the morning. So you're brushing with a little 10 milligram hit if you want it in the morning. Just a little wake up, right?
Yeah, and it doesn't last as long. So
Yeah.
the other thing is like people use it after lunch to freshen up, get a little bit of a
Yeah.
boost their afternoon, but they're not going to ruin their sleep that night.
Yeah, because there's people that take tablets that absorb under their tongue. We prescribe Zofran that they just put in
Hmm.
their tongue and dissolve. There's obviously nitro tablets, things like that. So that's awesome.
Yeah, and like we have another one that's immunity that has vitamin D and B12. And so that one, there's a lot more research on how much absorption actually happens in the mouth, so we dosed it accordingly. And that's another benefit of the tablet is unlike traditional toothpaste that you just get a pea-size amount, it's
Yeah,
like all of
it
our tablets are
varies.
380 milligrams. We know exactly what people are taking.
Yeah,
So that one was more like prescribed of how much we put vitamin D or B12 in. But with the caffeine, that was just trial and error. I mean, we started with some pretty high doses and it's like, whoa, this is, way
this
too
is like
much.
ephedrine. It's like,
Yeah.
they used to have that ephedrine stuff before it got banned. But yeah, that's really cool because I used to use, I think Kiehl's. It's like a facial cream that for guys, they market it. It has caffeine in it, like a facial wash, and it had caffeine in it. I tried that for a while just because you wash your face and you feel like maybe there's some caffeine getting in you. So I think there's lots of products that have tried that or do that. But to see like a little 10 milligram hit in toothpaste is kind of cool
Yeah. No, it was
because the
really cool.
absorption is really good in the mouth,
Yeah, the absorption's good,
better
and
than
you feel
skin.
it. It's proof of concept right there. Like obviously, vitamin D, it's therapeutic and beneficial, but it's not like you feel anything from vitamin D when you're
I mean,
brushing
is
your
that a
teeth.
big seller in Seattle, the vitamin D one?
I mean, yes, vitamin D. I use it every morning. It's a crazy number. It's like 80% of the country is deficient in the winter months. Especially if you're north of San Francisco or Philadelphia.
Yeah, if you're Pacific Northwest, you're feeling the low hit on vitamin D normally.
Yeah, and also just Western culture. We evolved to be outside, and now we're sitting in. We're not getting that sunlight when we're taking out wisdom teeth, or if you're sitting at your desk on your computer. It's just we don't have
Yeah,
that exposure.
right. Yeah, we can't work remote, so we got to be in the office. That's
Yeah,
true.
this is true.
That's cool. So there's four different kinds, and the pill thing is cool to me because, like, you're always like putting a little bit of paste on your brush, and the amount varies. It's never the same. Like it can change, and kids use it. It's like there's so much flux with that.
Yeah, and that's even what's interesting about, all these studies about fluoride and how much is in the water, but it's all based on a concentration, not a dose, right? Like in the US where there is fluoridated water, it's zero point 0.7 milligrams per liter. But if you have 1 liter of water during the day or 2 liters of water during the day, you're getting double the exposure to that fluoride. So it's a way to same thing like, if you use one pea size worth of toothpaste versus two pea sizes worth of toothpaste, and who knows what that really is.
Right.
You're even though the concentration's regulated or advised at least, you're getting double the dose. So it's a way to actually know what people are getting and yeah.
So why use fluoride at all? Is it just because it's the most widely studied overall because it's the oldest?
Yeah, I mean, it's an interesting history of fluoride.
Because like there's fluorosis, like we haven't even touched on some of the things like that, what fluoride can do.
Yeah, especially, and a lot of this conversation is like topical fluoride versus systemic, right? So topical being what you rub on your teeth, systemic being what you consume and is in your bloodstream. And essentially, especially for kids 8 years and younger, where the adult teeth are still developing in the jaws, too much systemic fluoride can make those get fluorosis, which, is like white spots. I mean, more of a cosmetic issue than anything, to be honest. I don't know if that's one that really sets the alarm bells off, but
Yeah.
there's always been controversy about fluoride because it's the only therapeutic thing we put in our water supply, and 70% of Americans are exposed to it.
Yeah, I think in Washington state we have fluoridated water, but in Oregon they don't. And so it does vary state by state.
Yeah, and like Utah and fluoride just took it out of their water. Most of Europe doesn't have fluoride in their water. I think one of the more interesting studies, or what's kind of evolving, is this like it's a correlation with IQ. So we don't know, but these studies are getting better and better, and it's reason to take pause. And we've known for a while that in places other than the U.S. where fluoride exposure is much much higher, that they've established a dose-dependent relationship with pregnant maternal exposure to fluoride, and it will decrease in IQ. But it's always come with that caveat that the exposure levels are just way higher. So, what do we know of that? But in 2019, there was a study done and published in JAMA Pediatrics that was done in several cities in Canada. And it's pretty cool from an epidemiological study standpoint in that most public health studies, you look at the outcome and then you look back for the exposure. But what they did is they tested the urine of pregnant women in all 3 trimesters for fluoride. They also tested for other heavy metals that could affect cognitive performance. And then they followed those women until their offspring were 3 to 4 years old and tested them. And they found that in boys, and when the boys and girls were combined, there was a statistically significant reduction in IQ. And that one was really important because Canada has the same 0.7 milligrams per liter fluoride exposure as we do in the US. So it was the first time that a really high quality study in a high quality journal was produced that, at least gives you pause. Like, I don't think we can put a stake in the ground based on one study.
Right.
But it gives you pause. Like, if we have something that's just as effective as fluoride and we're already getting it in our drinking water, and maybe there are these concerns, why not use this nano-hydroxyapatite in our oral care products? Kind of where we got with the logic.
I mean, just based on that and just everything surrounding it, at this point, it just makes sense to me to just switch it up and not even use fluoride, not worry about it. And the other thing is, what about kids? So the kids can use this product too then, safely?
Yeah. Yep. Kids can use this safely as well.
Because, when my daughter's 4.5 and, when I brush her teeth, it's sometimes she does swallow some of the toothpaste. They're just kids, And so I'd feel better if she's not swallowing fluoride all the time either.
Yeah.
So that's cool, and the fact that you kind of know the dose each pill gets the same. You're not going to get too much, too little, like, that kind of stuff. That's really cool. So how's it going so far with the business? And then you're a full-time surgeon or part-time? Like, how does this work?
Yeah, so we have our 2 other friends are full-time on it. And so they have non-dental backgrounds, but come from more of a law, finance, product background.
Yeah.
So they're, because me and my wife are mostly full-time. We have a nice schedule, so it's not.
That's awesome.
We still have time to work on the toothpaste company, but
yeah,
it's going great. I mean, it's been fun to just learn about things outside of medicine and dentistry and patient care as well. Marketing, we do a lot of meta campaigns, and we tried our hand at TikTok, which was a little tougher than we thought. But it's going great. I mean, what's really cool to see with a product like ours is the retention rate. I mean, once we have customers, like, they're not going away. We hang on.
Yeah, so you get someone that orders it and they order again.
Yeah. No, our retention rate.
That's a big deal. That's a big deal.
Yeah, so that's, it's great to see that the refill, and what's cool too that people appreciate is, so you get your bottle, but if you subscribe, then the refill tablets come in a compostable envelope. So then you can just refill the bottle, and again, just trying to reduce carbon footprint and all that as well. Yeah, no, it's been a great journey. It's certainly ongoing, and we're working on it. We appreciate getting the word out, podcasts like these, and just talking to our dental friends and everyone else, and momentum's going in the right direction for sure.
No, I love it. I really appreciate you coming on here. I learned a little bit. I think people learned a little bit too about a little bit more to look up, honestly, look up hydroxyapatite, look up fluoride, look up other things, do your research. And I think on your website for Duo, there's lots of other papers that it alludes to that have already been done. You can obviously, anyone can do a PubMed study on their own, but that's really cool. I really appreciate you coming on, my man.
Yeah, no, I appreciate you having me. It's great to finally meet you.
All right. Take care.
You too.
Bye.